Hi, my name is Dr. Judd Boczko. I'm a urologist here over at WestMed Medical Group. I'm here to talk about the benefits of HIFU today for men with prostate cancer. To find out more or to get a review, you could also go to my website, www.hifuny.com. And today we're going to talk more about specifics of HIFU in relation overall to prostate cancer. So prostate cancer, as many people know, is the #1 newly diagnosed cancer in men. Approximately 200,000 men will be diagnosed with this disease on a yearly basis, and up to 30,000 men will die as a result of the disease. Now, when someone is told about a prostate cancer diagnosis, it certainly is a shock, and that's fully understandable, but we have to look at is prostate cancer is not a one-size-fits-all disease. You have to look at the pathology information based on the biopsy. So one of the things you look at is something called the Gleason score. The Gleason score is usually between a 6 to a 10. Gleason 6 is generally considered a lower grade cancer in the majority of cancers. Gleason 7 is intermediate, and Gleason 8 and higher is all high grade disease. So you have to look at that. You also have to look at the volume of cancer found on a biopsy. There's certainly a difference whether you find cancer in one small area of the prostate versus throughout the prostate. And there are also some newer tests that are involved called like a Polaris test, which is a gene-based test to look at how aggressive the cancer is for a prognostic purpose. Now, once someone gets through all that, they have a big decision to make, which is, what should I do if I have prostate cancer? And that's a huge decision, and someone should sit down with their urologist and have a long talk about what is best for them. Because as I said before, and I really think that that's true, it's not a one-size-fits-all disease. You have to tailor-make the treatment to the individual. And the way to compartmentalize it is you think about 3 different options in terms of a treatment tree. One option is active surveillance. Active surveillance means not that you're ignoring the cancer, but you're closely observing it. And there's a certain protocol in place if someone chooses active surveillance. People who might choose active surveillance are people who have low-grade cancer found specifically in one small area of the prostate, but there are other people who might be candidates as well. But once somebody chooses the option of treatment for prostate cancer, they really have to think about surgery versus non-surgery. So the non-surgical options are varied. They include radiation therapy like IMRT, which is external beam radiation therapy. It includes cyberknife radiation. It includes brachytherapy, what we call seed implant radiation. And then you have the non-radiation options, specifically HIFU. So the way to think about it is surgery versus non-surgery. Now, surgery, I happen to be a robotic specialist, and I'm probably one of the few robotic specialists who also perform HIFU within the country. So I have a very specific perspective that a lot of people don't have. But surgery, the best part about it is that in terms of curative potential, nothing is better than surgery because you're removing the cancer. You're not leaving the cancer inside the prostate and hoping that whatever energy modality you're using to destroy the cancer will work. You're not leaving that up to chance. You're going ahead and removing the cancer. But surgery has its downsides. It has its risks. Specifically, surgery has a risk of urinary incontinence and erectile dysfunction. Urinary incontinence should not be a permanent issue, but it could take months to get better, which is certainly an issue that no one wants to have to deal with. And erectile dysfunction is a risk factor regardless of whether you're choosing surgery or the non-surgical options, but the risk of erectile dysfunction varies depending on what option you choose and what your erectile function status is overall. But the benefits of HIFU, which we'll get to soon, the big benefit is in terms of potency, it's your best option for maintaining your potency. That being said, in terms of surgery, it's your best option in terms of curative potential. And that brings us to what I call the trifecta, or the home run. There are 3 boxes you like to check off of in terms of the best option for someone. 1 is curative potential, 2 is urinary issues, 3 is sexual issues. And ideally, you like to get the option or the treatment results that gets you cured of prostate cancer, minimizes your urinary side effects, and maintains your potency. Now the problem is there's no perfect option out there, and you have to weigh the pluses and minuses of each option. So we spoke about surgery. I'm not going to talk about all the different radiation options because we're here to talk about HIFU. And HIFU really is an alternative to all the different radiation options out there. Currently, HIFU is not FDA approved in America. It's actually still considered experimental, although it's approved everywhere else in the world. In Europe, in fact, the European Association of Urology, which is the equivalent of what we have here in America called the AUA, the American Urological Association. So in Europe, the EUA actually lists HIFU as one of their therapeutic options for prostate cancer. It's not experimental in any way. In France, it's one of the approved reimbursable options as well. So everywhere else in the world, it's not considered experimental, and hopefully in the U.S. it will not be at some point in time, but for our purposes right now, it is considered experimental. There are two companies currently that produce the HIFU technology. One is called EDAP, which is a French company, and they have a machine called the Ablather machine. And the other company is called Sonicare, which is a US-based company, and they have the Sonoblade 500. Both perform HIFU, both have excellent results, and both, again, maintain potency and minimize urinary effects. So I like people to think about HIFU as an alternative to radiation. Certainly an alternative to surgery, but again, in terms of a treatment decision, you could think about surgery versus non-surgery. And if you choose a non-surgical option, HIFU might be an excellent option for someone. Now, what is HIFU? What does it entail? It uses ultrasound energy to destroy the cancer. So HIFU actually stands for high-intensity focused ultrasound. And what it is you're beaming down ultrasound waves from what we call a transducer. And the energy used is 10,000 times the strength of an ultrasound energy used when we do a kidney ultrasound or a bladder ultrasound or a regular ultrasound if you go to a radiology department. We're using the same energy but multiplying it 10,000 times. And so it's like an invisible laser beaming into your prostate to destroy the gland. And the difference between using ultrasound energy versus the radiation options is that with radiation, when you hit point A, the area around point A will be affected by the radiation. There's no invisible lead barrier holding the radiation into that point that you're hitting, so the radiation can spread and have detrimental effects. Specifically, it could cause urinary issues because it could affect the bladder, and it could cause erectile dysfunction. HIFU, though, has what we call a steep temperature gradient. So when you hit point A with the HIFU energy, a millimeter off, 2 millimeters off, there's no temperature rise at all. The temperature of that tissue is cool. So there's no surrounding effect. Thereby, you minimize any surrounding effect or damage to the surrounding tissue. Therefore, it allows you to maintain your potency by not injuring the blood vessels and the nerve bundles near the prostate as much as any of the other options. And that's the real benefit of HIFU, is that it doesn't replace surgery. Nothing's going to be as good as surgery in terms of curative potential, but if you're choosing the non-surgical options and you're choosing between radiation and HIFU, HIFU gives you a much better alternative in terms of minimizing the urinary side effects and maintaining your potency. The procedure itself, in general, takes about 3 hours. It could be as short as 2 hours. It could be as much as 4 hours. It depends on the height of someone's prostate. It is done under a general anesthetic and is outpatient in nature, meaning that the person goes to the hospital or a surgery center, gets it done, and goes home the same day. People can go out to dinner that same night. They can go out the next day. They can enjoy a day off if they like. They will have some side effects. They will have some urinary issues. You actually will have something called a suprapubic tube, which is a urinary tube coming out right below the belly button, not through the penis. So you're not going to have that penile pain issue that people have if you have a catheter in the penis. And you'll feel a little swollen, and eventually your urination should go back to normal over the following few weeks. So you'll feel a little bit more irritative in nature, but no one would know they actually underwent an operation. And the satisfactory rate, which is the best way to kind of decide which option is really good for people, if you ask patients, and I certainly have patients who'd be happy to talk to people, if you ask patients whether they're happy or not with the treatment option, the satisfaction rate of people undergoing HIFU is way above and beyond any of the other treatment options. Because again, curative potential is excellent, and you're minimizing those side effects. To find out more about this procedure, again, you can go to www.hifunyork.com. I'm Dr. Judd Boczko. Thank you.